Welcome to the DVM365. Give us 5 minutes or less and we'll update you with the veterinary news, medicine, and business information you need to know right now. I'm Dan Verdon, editor of DVM Newsmagazine. This edition of The Five comes to you from CVC in San Diego, where veterinary professionals from across the world gathered to access cutting-edge veterinary education. Check out the latest technology and soak in some serious sun. Today we'll hear from Dr. Marty Becker, get an update on the bill that seats a technician on the California Veterinary Medical Board, and more. First up, here's Veterinary Economics Editor Christy Reimer with Denise Tumblin, CPA, discussing the ongoing problem of decreasing veterinary appointments.
Denise, there's been a lot of talk in the industry and the profession recently about the declining number of visits to veterinary practice and why that's going on and what we can do about it. So I wondered if you could comment on that a little bit and maybe first of all tell us, is that something you're seeing in the well-managed practices that you work with?
Well, there's no doubt there's a lot of talk about it. And one thing I can say, at least to date, in our benchmarks, well-managed practice studies, we're seeing a steady number of transactions, not a big increase, not a big decline, but steady, holding steady. So that's a positive sign. I think a lot of this is unfortunately fear-driven, and it's hard to not be affected by that when it's hitting you every day.
I'm Christy Reimer reporting for The Five.
I'm Dr. Robin Downing, and this is Tommy, and you're watching the DVM 365.
Hi, I'm Carrie Hiller-Johnson, editor of First Line Magazine and the team sections of dvm360.com, and I'm here with Tracy Mumby, a registered veterinary technician here in California, and she sits on the California Veterinary Technician Association Board, and they have just recently signed into law here a bill called the AB 1980, and it gives veterinary technicians a seat on the Veterinary Medical Board, and that's the first time that has happened. So Tracy, I'm curious what you think that significant event means for the profession in general as well as technicians specifically.
Well, since the first licensing of the RVT in California in 1975, technicians have really taken on a crucial role in veterinary practices, not only with patient care, but setting the standards for and maintaining quality of medicine within the practices. And we're even finding them more and more now in the role of management within the veterinary hospitals. So in essence, having an RVT on the Veterinary Medical Board elevates the status of our profession and really represents the true makeup of the veterinary personnel in the field.
Skin diseases and atopy in particular are among the most common conditions that general practitioners face. Here, Dr. Tom Lewis, a veterinary dermatologist lecturing at CVC San Diego, shares his thoughts on incorporating ketoconazole with atopica treatment.
Well, I tend to do that more in the large dogs compared to the small dogs, and the reason I'm worried about it is because with the ketoconazole, it's just one more drug the liver has to metabolize, and even though we don't have to use real high levels, it's not like we have to use all of the high antifungal dose, it's still a dose that requires the liver, it has to metabolize it, we have concerns of what it will do to the liver, and there's monitoring necessary, thus reducing some of the cost savings. So I rarely will use that technique in small patients. In larger patients, I will use it maybe in 25 to 50% of my patients will add that in. Many of our allergic patients have secondary malassezia dermatitis, and in those patients it's at least justified because now we have another reason to justify the ketoconazole.
You've seen him on Animal Planet and Good Morning America. And this week, veterinarian, communicator, and author Marty Becker was a featured speaker at CVC. In this clip, he touches on one of his themes, pets as healers.
I can still remember growing up on the family farm in southern Idaho, and our pets really were considered animals. Our dog lived outside in an old calving shed and had a utilitarian role, retrieving ducks, herding cattle, guarding our stuff. Then I remember the time when he came inside for the first time. He actually went from the barnyard to the backyard to the back door to the bedroom. Then we started called Luke the Labrador Retriever a pet. And now in most veterinary hospitals, we know that people consider themselves their pet's mom and dad and think of their pets, their dogs and their cats, as their children. But here's the next evolution, and I dare say revolution, as we go from animal to pet to child It's a life support system cleverly disguised as a four-legged family member. What do I mean by that? I wrote the book called The Healing Power of Pets, and you often hear people talk about, I hear they're using pets in nursing homes, I hear pets lower your blood pressure. Yes, and yes. But what you don't know is pets do incredible things from the miraculous to the mundane and how it affects human health, happiness, and longevity.
That's it from San Diego. If you have suggestions for future shows, email us at dvm360@advancedstar.com. And for the latest news, medicine, and business information, be sure to visit dvm360.com every day.